Our presentation is on good health and well-being in rural Nigeria. Here's our team. My name is Mariah Alonso.
Hi, my name is Ethan Arlo.
Hi, my name is Gabrielle Kaiser.
Hi, my name is Reese Sato.
Hi, my name is Jennifer Lopez.
As said before, our SDG is good health and well-being, and the problem that we all decided was extremely important to us was the lack of healthcare access. The structure of this presentation will be first introducing the problem of Nigeria struggling with quality of healthcare, low-income families struggling, especially mothers with children. The question of how can we fix transportation problems to healthcare facilities? How our solution will come to life, what we will make of this problem and make it better, getting out the word to everyone, and finally, the customer insight from about our clinics. Our problem is lack of healthcare access. The region we are focusing on is Africa. The country within Africa that we felt had the most struggles when it came to healthcare was Nigeria. So the lack of access to healthcare has been affecting populations worldwide, especially in undeserved and rural areas. Money is very low in Nigeria, especially for families like single parents, other families, and other kids with healthcare problems. And the children are suffering these consequences the most because they do have more needs than a regular adult. And some of these families don't have access to transportation, including their own car, enough money for a bus ticket, and these places, these hospitals and healthcare facilities could be hours away from them. So, the low income. Since Nigeria is generally considered a poor country, their distribution of health care facilities are inefficient, which makes access to them inadequate. There are 17 healthcare facilities per 100,000 people. So the families with no way of transportation struggle very much, and there's a lot of consequences to this, including delaying medical treatment, and then increasing mortality rates, and even reduce healthcare utilization, which could also be bad for the facilities because they would lose funds. This problem is bad for both the facilities and for the people of Nigeria because they are not getting the right treatment that they need. And even if they do, it's not consistent because they're always going to have to try to find transportation to these facilities.
So, moving into our customer insight, we're mainly going to be marketing towards low-income mothers in rural Nigeria. So, some of their characteristics include hardworking, and this is because a lot of them live in rural-based communities where agriculture is closely tied into their livelihoods, um, and they work so hard to provide for their family and their children, and also their community because the community is very much connected. Um, they're also extremely honest workers, so I think we need to reflect that honesty in our practices when it comes to how we apply our medical aid. And there's also some religious communities as well. I think it's mainly split 50-50 between Christian and Muslim, so just something to keep in mind. Um, when it comes to their needs, they're really looking for continuity of care and consistency of care. They're also looking for that sense of security, which we can definitely provide, and accessibility is huge. Our medical tents and vans that need to be in walking distance to their homes. Vaccinations are also extremely important. Malaria is transmitted a lot by mosquitoes, and so by vaccinating them to malaria, it will definitely reduce those infection rates and spreading and virus rates. First aid and sanitary first aid is very important as well, and just providing them just medical resources like band-aids, antibiotic ointment will all be super helpful for them. Touching back on their motivations, which I kind of previously mentioned, care for family health is very important to them, and the safety of the community as well. And then just on some key demographics, um, they are the majority of them are lacking in education relative to maybe U.S. standards or some other country standards. So keeping a clear explanation as to what our medical procedures actually are is going to be huge in gaining their trust. Um, their annual income amounts to about 190 to 335 US dollars. So they might not be accustomed to some of the uh, luxury or some medical supplies that we will be providing to them. So again, explaining exactly what we're giving them, super important. Um, And yeah, so the average household size is about 4.5 people. So just know that there will be crowds when dealing out our medical supplies.
The image depicts a mobile health clinic designed to serve the most rural parts in Nigeria. This clinic is towed by a truck to make healthcare more accessible for individuals in our target audience, just like Hassana, who's likely traveling on foot with children. The clinic operates as a pop up facility, starting with a nurse or healthcare worker who works at the front that will be checking people in, along with providing minor treatments and health consultations. On the left side of the image, we have a designated waiting area for those who need to be seen by a doctor inside the trailer for more serious concerns, or we also have a separate waiting area dedicated solely to vaccinations, given the high demand for immunizations in these communities. The clinic also features an information booth with pamphlets on illness prevention and other health resources. Additionally, the vehicles are on standby for emergencies, ready to transport people for critical cases that need to go to a hospital. Recalling from our customer insights, it's clear that people like Hassana need healthcare that's accessible, reliable, trustworthy, and practical. This mobile health clinic addresses those needs. The clinics are strategically placed within walking distance of rural families, enhancing accessibility because hospitals are scarce and often too far to reach on foot. The clinic also offers walk-in services, eliminating the stress and confusion of appointment scheduling. People like Hassana can visit at her convenience, bringing peace of mind and a reliable source of care. The clinic's organized routine, professional staff, and medically safe environment ensures that she feels confident in the care being provided and eases any concerns she has for her or her children's health concerns. And lastly, there's no financial burden for patients. The clinic's services are fully funded through government assistance and partnerships, ensuring that nobody pays out of pocket. This alleviates hesitation to seek medical help and improves health outcomes while addressing the Sustainable Development Goals, or SDGs.
Hi, my name is Risato, and I'll be going over our revenue model and our pricing strategy. We estimate that around 65% or $220,000 of our costs are going to go towards our fixed costs, and around 35% or around $115,000 is going to go towards our variable costs. You can see the breakdowns, how we got this number on the left-hand side here. We are assuming that the clinic visits around 5 rural locations per week and provides services to around 50 patients per location. That gives us around 250 patients per week or about 10,000 patients per year. And assuming that a government subsidized about half of our total costs, it would leave us with around $167,500 that we would have to come up with off of our revenue. Using this number, we can price out of our product. So our pricing structure, we estimate out of the income levels of the areas visiting that around 50% are going to be in that low income range, 25% in the middle income range, another 5% in that high income range, and then just 20% that are going to be unable to pay whatsoever. Knowing this, we can price out our product, and we assume that they're going to be around 10,000 patients per year, and our total break-even cost is $167,500, which would price out our product at around $16.75 per patient. We decided to use dynamic pricing. By using dynamic pricing, we can accommodate to the people who can't afford healthcare while still being able to hit our break-even point. In the case of our patient Hassana, she would qualify for the free healthcare as she is unable to pay for her services. Other individuals will have different pricing based off of their income levels, so it is still affordable for them. This allows us to provide for everyone, but still hit our break-even point so we do not lose our money.
Our communication strategy is built around addressing the healthcare challenges faced by underserved communities in rural Nigeria. Our promotional campaign aims to empower low-income families in rural Nigeria to access essential healthcare services through mobile health clinics and to bring critical healthcare services to underserved communities by promoting mobile health clinics as a trusted, accessible solution. Our call to action message is a rallying cry for the community. This not only invites families to participate, but also fosters a sense of collective effort and empowerment, positioning these clinics as a solution created with the community for the community. The tagline, "Where Health Finds You," embodies our commitment to meeting families like Hassana's where they are, both emotionally and geographically. This message is designed to inspire hope and convey that healthcare is no longer out of reach. In the mock-up to the right, you'll see how we visually connect with our target audience. The bright, welcoming imagery of the mobile clinic, surrounded by healthcare professionals, reflects trust and reliability. Our appeal centers on accessibility, empathy, and trust. For example, we feature visuals of doctors interacting with families and children in a caring manner, creating an emotional connection with the community.